As for treatment, treatment, again, is individual. That is, you need to consult with a doctor. Everything depends on the size of the stones, on where the stone is located, at which point, right, in which place, and whether there is a tendency for bile stasis or not. I'm not a supporter of surgical treatment. Yes, there are indications, especially if there is an acute attack, then in that case, surgical treatment is 100% necessary. But if it's not a chronic case, then I'm more in favor of conservative therapy. As for surgical treatment, in principle, there are already, unfortunately not here yet, but in Europe, methods for removing gallstones without removing the gallbladder itself. So there is also such a treatment method, and I hope it will appear here soon as well. Why am I against surgical treatment? The thing is, when the gallbladder is removed, bile production doesn't stop. Bile is produced in the liver. And later on, all those stagnation issues I mentioned happen at the liver level, and cholestatic hepatitis often develops. So even if you've had your gallbladder removed, patients often come in with complaints like, "Doctor, I'm still in pain. It still hurts on my right side. I still have a bitter taste in my mouth. I still have heartburn." Because one of the signs of gallstone disease is something called reflux esophagitis, which means bile is flowing back into the stomach. And this is often diagnosed during a fibrogastroscopy. That's why, first of all, you need to figure out the reasons why, yes, bile isn't being produced properly. What's the cause? It could be a spasm of the ducts. It could be a problem with bile release. This is all connected: the autonomic nervous system, diet, and the functioning of the gallbladder. So there are a lot of reasons, and each case needs to be treated individually. Choleretic agents, which are usually plant-based, and everyone likes to take choleretic medications. Again, I'm not against them, but you really need to be careful. The dosage, when to take them, how much to take. Because yes, there are contraindications as well as indications for taking choleretic drugs. Again, it's individual. So just reading about it and taking it, not always a good idea. There are medications for treating gallstone disease. These are specific medications that help thin out, basically dissolve the stones, and normalize the function of the gallbladder. One of these medications, which I personally really like, is ursodepovian. It's a complex medication, you could say, and it also affects liver function, right? With hepatosis, the liver works very well with it, and in general, it also helps the function of the gallbladder. When it comes to medications, there may be a need for antispasmodics, right? Like, the thing is, our gallbladder is directly connected to our autonomic nervous system. That's our emotional background. So sometimes sedatives are prescribed, antispasmodics are a must, and metabolic therapy is used to normalize function. In this case, as I said, it's also essential to check intestinal function. As for the diet in gallstone disease, the first thing you should not consume with gallstone disease or chronic cholecystitis is milk and dairy products. Why? Because their digestion specifically requires bile acids. In this case, patients produce very little of them, so kefir and cottage cheese won't have a positive effect, only a negative one. That is, they will make the condition worse. And a person won't always feel it right away. So in this case, if you really want something dairy, it's best, if the person can tolerate it, to have a little sour cream or butter. But again, you also need to consider the function of the pancreas, what's going on there. In this case, you can also do a food test, which we conduct at our clinic. That is an individual selection of food products. It's done based on the enzymes in your saliva. So you check which enzymes are present and which aren't, and then choose the right diet to eliminate risk factors. What's beneficial? What does the gallbladder like? It likes two tastes, sour and bitter. Why is it that, as a rule, all choleretic herbs are bitter? And as for sour, it could be fermented foods, not pickled, and maybe a little lemon juice. But again, you have to look at combinations, because if, for example, there's gastritis with high acidity, then sour foods are contraindicated. So again, everything is individual, and an individual approach is needed. Choleretic herbs include artichoke extract. It comes in tablets, and there are syrups for children. There are also, yes, things like holivia, hafetol, articol, and holstina, which are very well tolerated. There's also immortelle. Could also be tansy. There's also corn silk, for example. But again, you have to be careful with choleritic agents because yes, they are indicated, but everything is individual with a specific dosage and at a specific time as well. What is absolutely forbidden to eat besides dairy products? Absolutely forbidden are fatty foods. All kinds of sausages, fatty meats, and fish. Smoked foods are strictly off limits. You can't have anything fried in oil, whether it's vegetables, meat, or fish. And it doesn't matter what kind of oil is used. Baked in the oven, boiled, stewed, or cooked in a slow cooker is allowed. Sweet drinks are not allowed, and carbonated beverages are strictly forbidden. You also need to be careful with juices. Vegetable juices, in principle, are allowed. You can have black or green tea. Coffee is allowed if it's natural, not instant, and definitely not those 3-in-1 mixes, so only natural coffee, and even then, just 1 cup a day is okay.